25 years ago is when I first heard Dr. McDougall. My husband and I were at a dental convention, and he was a speaker, and we only got to part of it. My mother had just had a triple bypass. I had congenital high cholesterol, and we were always interested in eating healthy, whatever that meant to us in the 70s. So when we heard him, we were both struck by how true it rang for us. And my husband Mark and I went home, we changed our diet, became more healthy, became McDougallers, and that went along well for several years. Then I sort of fell off the wagon, go out to eat too much, eat the wrong things, and before I know it, I've ballooned up to 180 pounds. I was 44 years old. My husband and I were scuba diving in Belize, and I had a heart attack underwater, 130 feet underwater. So that was 13 years ago. I had suffered from chronic back and neck and hip and joint pain for many, many years. That really didn't improve that much when I changed my diet. And I kept trying. I did lose weight. I got down to 140 pounds, lost weight, still was fighting this battle with pain. Finally, I had written to Dr. McDougall about another little issue I had, and he said, stop the gluten. So I said, oh, okay, that's easy enough. So we were going on vacation, and I got quinoa and millet, and I knew what to do. I taught cooking for Dr. McDougall in the 10-day program for years. And then I decided, I actually found just the gluten issue that the pain was much better just in a week or two. And subsequently discovered that I had problems with a lot of grains and some nuts, oats, corn was a big issue, and I cut all of that out, increased fruits and vegetables, sweet potatoes, millet and quinoa, and my pain is gone. And the pounds fell off. When these foods that were not right for me, I quit eating them, and the pounds fell off, and I went down to 125 effortlessly, really. I was still eating some seeds, tahini dressings and things like that, and avocados, a few, I didn't go crazy. And the pain is gone, and I'm like speechless about it. 20 years of pain, and it's gone in a month. So I credit Dr. McDougall for being my mentor all of these years, for finally saying, stop the gluten. Now, to his credit, he told me many years ago, because he was my doctor, he told me, about the back pain and all that, he goes, it's inflammation. It's just like heart inflammation. Back pain is inflammation. You need to figure it out, and maybe you need to go on an elimination diet. And I didn't want to do that. I finally did it in November of this year, and I did an elimination diet and discovered that I really was reactive to all these things. And I've been exploring exercise and other things that are adjunct to the food, and for me that make me feel better, but really the starting point is the food. You've got to get the food right, whether it means just stopping meat and dairy and eggs, which is the bare minimum, and then figuring out the rest of how to find optimum performance for yourself. If Dr. McDougall and this program hadn't existed, if I hadn't heard him 25 years ago, had my mother go through the program, me go through the program, I'm afraid I'd be fat and sick like 90% of the people around me are. I wouldn't be slim. I'd probably be on statins and in pain, chronic pain. I may have died from my heart attack instead of surviving and thriving afterwards and being more healthy than I was 13 years ago when I had a heart attack. I truly am. I'm more healthy now than I was 13 years ago. I was 180 pounds, I'm 125 pounds. I was in chronic pain, I'm pain-free. I can exercise, and I could hardly do the dive. I didn't want to go diving. So really, in a nutshell, I might not be alive. I certainly wouldn't be thriving.